Thank you all for being here today. Leader McConnell, welcome back to the University of Kentucky, and thank you for joining us. We look forward to learning and hearing even more about how your work in Congress will enable us to reinvent and reimagine our future. We are grateful for your strong advocacy on behalf of Kentucky students and families who have been impacted by this coronavirus outbreak. The Commonwealth looks to the University of Kentucky as a beacon of hope. The safety and well-being of our community, all we serve, has been at the center of everything that we do and what we will do. At the beginning of the outbreak, we wasted no time. We established 19 work streams around the important areas of our campus to prepare for and address all matters related to COVID-19. Our people have worked hard to position the university to thrive once we emerge from this crisis. In March, thanks to the leadership of Senator McConnell, the CARES Act was passed and signed into law. It has become a remarkable resource for our students and their families whose lives have been upended by this public health crisis. The funding will provide crucial support for the estimated 5,500 students eligible for assistance. More than $8.9 million of emergency funding will be directed to aid students to support their education during this challenge. And as of May 21, over $5.1 million has been distributed to nearly 3,600 students. We are committed to providing any relief we can so our community can continue to heal. Because of congressional leaders such as Leader McConnell and committed individuals in our community, eligible UK students can receive the support they need in this time of great uncertainty. And our HealthCare team, they've been working around the clock to help Kentuckians heal. The federal funded provided by the CARES Act will improve access to personal protective equipment, or PPE, and testing services that we need. With the financial support, our frontline heroes across the state can continue their hard and important work as we step up to this challenge. This is a journey. We are grateful for the continued support from Leader McConnell and so many compassionate people in our community who allow us to do what we must do as the University of, for, and with Kentucky. I now want to turn it over to Kimberly Blanton, who has been a registered nurse for over 22 years and has dedicated her life to taking care of people. Kimberly has been instrumental in our response to this pandemic. When a patient tests positive for the virus, she personally calls them and immediately starts helping them through their next steps. Because of her, patients and their families never have to feel alone. Her care for the Commonwealth has been unwavering during this public health crisis, and her dedication to our community is why she is one of UK's heroes. Kimberly Blanton.
Thank you, President Capilouto, and good afternoon. On behalf of the many frontline employees here at UK HealthCare, I want to thank Senator McConnell for visiting our facilities today and for his leadership in providing the CARES Act funding, which is critical to all of us as we continue to care for the COVID-19 patients and for all the patients who need our help during this unprecedented time. UK HealthCare began taking measures to prepare and to monitor patients with the novel coronavirus in mid-January. And on Friday, March the 6th, our hospital began caring for the very first patient in Kentucky diagnosed with COVID positive. Since then, we've had 272 patients diagnosed through our in-house clinical laboratory with the COVID-19 virus. And to date, we have treated 84 COVID-19 patients that required an inpatient care at some point in their battle with this novel disease. Since our first patient was diagnosed as COVID positive in early March, just like the rest of the nation, we've learned a lot of new things about this disease. And we continue to learn more about how best to care for the patients, protect our healthcare workers, and the community. However, from day one, I have never been so proud to stand next to our dedicated and caring team of healthcare professionals, our nurses, our physicians, our respiratory therapists, radiology technicians, advanced practice providers, the therapy teams, the support staff. They have all worked tirelessly to care for our patients. And everyone continues to put the patient first, even in some cases isolating themselves from their own families. During this time, we have seen our teams of people come together and do extraordinary things under some of the most unordinary circumstances. From our war room of supply chain specialists who have found innovative ways to obtain critically needed personal protective equipment to the nurses who have literally been stepping outside their normal setting to provide drive-through testing for patients and healthcare workers in the parking lot at our Turfland location. We have seen amazing things accomplished despite our daily challenges. Today, we know the fight is far from over, and the upcoming months may present new challenges for all of us. However, we also know our hospitals, our clinics, and our employees are prepared to handle what lies ahead. We are so grateful for the support of our leaders at UK HealthCare and the university, and to you, Senator McConnell, for your dedication in supporting our efforts in Kentucky's ongoing fight against COVID-19. I'd like to now invite the leader of our healthcare team, Dr. Mark Newman. He is our UK Executive Vice President for Health Affairs, and he has led our UK Med Campus since 2017.
Thanks, Kim. Leader McConnell, let me start by thanking you for visiting the University of Kentucky and UK Healthcare today, and to thank you for your leadership. The CARES Act, which you led the passage of, has been essential for hospitals and healthcare systems across Kentucky, facing both the COVID crisis and the economic shock of this unprecedented time. The CARES Act has already provided nearly $47 million of support for UK healthcare alone. These are critical dollars for us to be able to provide patient care, protect our employees with critically needed PPE, and provide access to clear and important diagnostic testing. Sir, your leadership, both for our Commonwealth and our country, is tremendously appreciated. Thank you. With this strong support, I am extremely proud of UK Healthcare's response to the COVID-19. All of our employees, from our nurses and our leaders like Kim Blanton and our providers, are all heroes. Our healthcare workers have the skill and expertise to deliver exceptional care to our patients, but they continue to need our support and the resources to be able to do this safely. We have met this challenge with ingenuity, tenacity, and without hesitation. For UK Healthcare, this is who we are, this is what we do. We are now taking a slow and measured step to restart our healthcare system with a wary eye towards COVID and a willingness to make changes or innovations to put safety of our patients and our people first. Kentucky is lucky to have a senator in a leadership position fighting for us in Washington, D.C., ensuring that we are receiving the necessary support from Health and Human Services, from the Center for Medicare and Medicaid, FEMA, and other federal agencies connected with this COVID response. The Senator's office has been proactive in making sure that we have everything that we need to care for our patients. Kentucky also has some natural advantages. We have natural spacing, we have this strong social fabric, and we have determined Kentuckians working hard together to slow the rate of spread. As a native Kentuckian, I am proud of how we have responded to this crisis, and I know that we are up to the challenge of restarting our Commonwealth in a smart, safe manner. At UK HealthCare, we have put additional measures in place to make our safe environment even safer for our patients and our frontline workers. We are performing COVID testing on every patient admitted or undergoing a procedure, and we are performing antibody testing as well. We are running a separate emergency area for COVID patients and those with symptoms of COVID, so that other patients with emergencies can feel safe in seeking care. This coronavirus may be novel, but the requirements for a safe environment of care are not. This is our area of expertise. We're using universal masking, hand hygiene, sanitizing, personal protective equipment, and more to meet our high standards. We are innovating with curbside pharmacy delivery, curbside registration, drive-through testing, and highly expanded telemedicine, just to name a few. Even though many aspects of our life are starting to open up, COVID is still in our community. It is important we wear face masks and practice social distancing. And for those patients in high-risk categories, you should continue to use caution. However, if you feel sick or have been putting off care that you need, please call your healthcare provider. We are your partners in helping you take care of yourself, whether in person, over the phone, or both. Whatever you do, do not put off necessary health care. In talking to our clinical faculty, the American Heart Association, and our partners, hospitals around the state, we are very concerned that our patients are putting off care, especially those with chest pain, with symptoms of stroke, or other acute illnesses. We have had patients showing up much sicker than they should because they are unnecessarily avoiding the hospital or their physician's office. At UK HealthCare and across the Commonwealth, we are prepared and committed to helping you get the care you need safely. So please do not wait. Senator McConnell and President Capilouto, I'll wrap up there and thank you again for this opportunity, and thank you both for your leadership. Thank you.
Thank you, Dr. Newman. Mitch McConnell is the U.S. Senate Majority Leader. Elected to that position unanimously by his Republican colleagues, first in 2014 and again in 2016 and 2018, he is only the second Kentuckian to ever serve as Majority Leader in the U.S. Senate. Senator McConnell was first unanimously elected by his colleagues as the Republican leader in 2006. He is the longest serving Senate Republican leader in the history of the United States. Recently, Senator McConnell introduced and led to passage the bipartisan Coronavirus Aid, Relief, and Economic Security Act, also known as CARES. The CARES Act was signed into law by President Donald Trump and became the biggest rescue package in U.S. history. I'd like to invite U.S. Senate Majority Leader Mitch McConnell to the podium to say a few words.
Well, thank you, Dr. Capilouto, Dr. Newman, Kim. I'm here today to thank all of them for what they've been doing during this crisis. They're the real heroes, and you saw them not only in Kentucky but all across the country, the people on the front lines, as we combated something we'd never experienced before. Nobody knew anything about this particular virus. uh, what to do about it, how to act around it, and we've learned a lot over the last few weeks. I was also proud of the Congress. Just think about this. We went from an impeachment in the Senate and House back in January, the most partisan thing you can imagine ever to be involved in, to a rescue package that started in my office, and there we developed it along with the administration and the Democrats, which ended up passing without a single dissenting vote in the Senate. So the Congress, too, drawing inspiration from the American people and from the frontline healthcare workers like you see here at UK, knew we needed to put aside our differences and address this as best we could. And boy, did we. We've spent about $3.3 trillion. We now have a national debt the size of our economy for the first time since World War II, and that is a matter of some concern, but it certainly needed to be done. From a Kentucky point of view, about $11 billion came into our state to help with small businesses. The last time I looked, there were 44,000 small business loans under the PPP program. And of course, with a heavy emphasis on hospitals and healthcare, because that's where the battle had to be fought. We're going to continue to look at the situation, and I think a logical question to ask is, where do we go from here? Well, I might say this is my first public appearance in Kentucky since March the 13th. So we're beginning to re-engage. Like everyone else, when the Senate wasn't in session, the Senate's been in session the last 3 weeks, but before that we were out of session for a while. I, like everybody else, was at home. My wife, who's in the President's cabinet, was at home. We were working remotely like all of you, and I think we learned during that process that there are a lot of things that can be done remotely, and we managed to stay pretty busy. And it'll be interesting to see how in the future some of our work arrangements that were significantly different during this period continue to remain. Now the economy is beginning to open up. The elimination of the elective surgery ban is extremely important to this hospital and every other hospital in the state. That's where hospitals avoid going in the red, because Medicare and Medicaid tend not to be a winner financially. And now people's delayed health care, as Dr. Newman was pointing out, are being addressed as we begin to move back to normal. Let me say this with regard to the way forward. We can't keep propping up the economy forever. We do need to begin to re-engage, to develop our activity again. We had the best economy in 50 years in February, and now we have Depression-era unemployment in a very short period of time. The ultimate solution is to begin to get back to normal. There are three things that are essential to have full normalcy: testing, treatment, and vaccine. In the last bill that we passed, again originating in the Senate, $25 billion for a Manhattan Project type warp speed effort to develop the vaccine and a better treatment than we currently have. I talked to two pharmaceutical CEOs last week who believe that there will be multiple solutions to this, maybe not one vaccine, but maybe more than one. Several of them are in clinical trials already, not only in clinical trials, but in production, so that if the clinical trials prove successful, they will have already ramped up production so that we can get a significant amount of doses, not only for our country, but for the rest of the world. Will it require Congress to act again? Probably. It will not be a $3 trillion bill like cleared the House of Representatives in a wave of controversy last week. It'll be much more narrowly focused on mistakes that we made the first time through. Also, analyzing what impact beginning to open the economy up is having. I noticed this morning consumer confidence is up. People are more optimistic than they were. And of course, about 2/3 of our economy is consumer spending, consumer confidence. Obviously, a lot of Americans have lost their jobs, so we need to make sure we have unemployment insurance properly funded for as long as we need. And that could well lead to yet another bill. Let me tell you what will be in it for sure if there's another bill. And that's liability protection, so that the healthcare workers, the small businesses, the universities that are reopening in the fall can be assured that there won't be a second epidemic of litigation. Already 1,100 lawsuits have been filed around the country in connection with this particular virus. Let me point out, it would not protect anyone from gross negligence or intentional misconduct. But we cannot have an open economy with an epidemic of lawsuits on the heels of the pandemic that we're working our way through. So I can guarantee you that if there's another bill, and there probably will be, it will include litigation protection related only to the coronavirus pandemic. So in the next few weeks, we'll determine whether there's yet another bill, and in the meantime, America is opening up, optimism is up, and we'll see how far we can get toward re-engaging our magnificent economy. So with that, why don't I throw it open for whatever questions you might have of me or any of us here. I can't hear you.
The next phase of relief, right?
Use the mic.
The next phase of relief. The talk is, Governor Beshear, several local governments have said that they need money because of the dipping revenue. They just don't have revenue at this point. Is that something that you're going to consider, and will you be giving, a bailout to state and local governments?
Well, I wouldn't use that term. We've already appropriated $150 billion for state and local government. The Secretary of the Treasury has defined the way that can be used rather broadly for coronavirus-related expenses. And it includes, for example, at the local level, things like police and fire. So it's a pretty broad interpretation. All the governors, regardless of party, would like to have additional assistance, and that's a possibility. But I would remind everybody that we have sent a significant amount of money to the states already, about $1.8 billion to Kentucky. About $133 million of it went straight to Louisville because it was above a certain population limit. I believe the governor has sent about $300 million, you could correct me if I'm wrong about that, down to localities already. And that money is still unfolding. So the answer to your question is, we don't know yet. We're still measuring the impact of what we've already done, and all of that money is not yet out.
Okay, because they've been saying it's a revenue. So Linda Gorton today said it's a revenue problem, and while the money has been helpful for reimbursing expenses that they already paid, the problem is that they're not bringing in more money now. Is that a concern for you, especially since so many local governments are already on the verge of bankruptcy?
It is a concern, and the $3 trillion we've added to the national debt is a concern as well. And so these are challenging times, both for state and local government and for the federal government. As I said earlier, we now have a cumulative debt the size of our economy for the first time since World War II. That's concerning to a lot of economists. So it's a challenging situation.
Hi, Senator. How long do you think it will take for the country to dig out of this?
Boy, that's
financially speaking.
That's the big question, and there are all kinds of economists speculating different things. And honestly, no one knows. I do think, though, that we are a consumer-driven economy. 2/3 of our GDP is consumer driven. So the ultimate solution is to get to a vaccine as quickly as possible. It's also important, I think, for people to Dr. Capilouto and I were talking about an op-ed today by Mitch Daniels, the president of Purdue, who used to be governor of Indiana, pointing out that there's a really tiny percentage of youngsters age 18 to 22 for whom this is challenging. So universities may look at it one way. If you're an older person and have pre-existing conditions, you probably ought to be extremely cautious and maybe still stay at home. For the rest of us, we're wearing masks, we're socially distancing. We did that in the Senate the last 3 weeks. We did just fine. We changed our behavior and paid attention to the healthcare directions that we were given by Dr. Fauci and Dr. Birx and the Capitol physician, and we were able to function just fine. So I can't answer your question. No one can. We're all hoping and praying for a speedy recovery. Remember what the economy looked like in February, the best economy in 50 years, and now it looks like the Depression. So I don't know the answer to your question. We're hoping for a speedy recovery.
Senator, you mentioned about Congress coming together on the vote for the relief bill. Has there still been, in your opinion, too much politicking over COVID-19?
Well, you shouldn't be surprised that there's politics in Washington. What was the famous line in Casablanca? Gambling in Casablanca. Yeah, I mean, look, I don't want to be overly political here today, but the $3 trillion bill the House passed about a week ago was laughable. There were 14 House Democrats who voted against it. It was not a serious proposal. What I think I can tell you is, if there's another bill, it will be a serious proposal. It will be confined to directly dealing with the challenges that are the outgrowth of the coronavirus pandemic, and not a sort of hodgepodge of other things that are unrelated to it.
Are you taking questions on other issues?
Sure.
All right. Well, there was an incident at the Capitol Sunday about an effigy of our governor. Our governor hung an effigy on the tree there at the Capitol grounds. Do you have a reaction?
Yeah, completely outrageous and unacceptable. We all believe in the freedom to speak in this country and the opportunity to demonstrate peacefully. But that episode, I believe on Sunday, completely unacceptable. That's not what Kentucky is, and I hope we will not be seeing that again.
Just one more question. The president has suggested moving the convention to a different site. How do you feel about that?
I'm going to leave that up to the RNC. I'll probably go wherever it is.
Thank you.
Okay, thanks everyone.